When I was 10 years old, my appendix ruptured and I was hospitalized for a long time. I had a pretty bad infection, and after that, I didn't really expect to have any more problems. I thought, it was fixed. Um, but I had a few problems from it, and then when I was 21, I was in the military. I became very ill, and at first they didn't really think it was anything serious. They thought it was just female problems. And when I finally saw a doctor in the military, they did a surgery right away and accidentally put a hole in my small intestines. And after that, I had some major complications, and I developed a lot of scarring, and they call it massive scarring of my abdomen, and that led to many more surgeries and just real bad complications. And I have kidney obstructions now and bowel obstructions, and just that's what started the pain. Each day it's difficult to work through the pain, but over the years I've developed a system to do it, and I've learned to listen to my body, and I can take hints from my body, if that makes any sense. And what I do is I try to give myself permission to have a slow day if I need to. I don't try to power through the pain anymore. If my body tells me to slow down, I slow down. And there's a lot of guilt involved with that. I feel like I'm shirking my duties or something, but I have to give myself permission to do that. Otherwise, I exacerbate the pain. So I have to learn to listen to my body and just give myself permission to take a break when I need to. For someone living with chronic pain, the advice that I would give to them is to be persistent in seeking care for yourself. For a long time, I lost hope that there would be a cure for me, and there is no cure, but I lost hope that there would be a treatment for me. And I found a treatment, but it took more than 10 years. And so what I would say is to maintain your sense of hope and keep trying and keep searching until you find a treatment that works for you, because there are treatments out there. And I think it's also important to find a physician who's trained in pain management. For myself, my hopes for the future are that I can basically stay the way I am now. My pain is under control. I have an intrathecal pain pump that works for me, and I don't know how long it will continue to work for me. I don't know how long I'll be able to have it. So in the future, I would like to be able to maintain my independence and be free from the debilitating pain. For pain management in the future, what I would hope to see is I would like to see more training for physicians in pain care. I think that's very, very important. Pain is a universal problem. It's common to almost everyone, and so we need to have doctors trained in pain care. I would also like to see doctors learn how to not judge patients and learn how to not make it a character issue, because having pain is not a moral shortcoming, and sometimes I think that gets lost in the fray. So I would like to see doctors learn how to separate the morality from the actual chronic pain sufferer. One thing that I would like to add is that I'm not a chronic pain patient. I am a person who has chronic pain, but I'm also a person who is a mother, and I am a wife, and I am a hiker and a gardener and a reader. And so my pain does not define me. It doesn't make me who I am. The other things do. So yes, I do have chronic pain, but I am not a pain patient. And I think that's really important to maintain your identity. The words of advice that I would give to people who are experiencing chronic pain are to not lose hope. For a long time, I lost hope that there would be a treatment for me, and it took me such a long time to find something that worked for me that I want to tell people to not give up. It's very important to stay with it and search until you find a treatment that works for you. Many times people tell a pain patient that it's important to stay positive, but I'm not really sure that's a realistic goal. Sometimes having pain is not a positive experience, and it's devastating. And to try to always feel like you have to stay positive, it's too hard, it's too much to ask. Instead of staying positive, what I would say is to honor the feelings that you do have and recognize that those feelings are normal. It's important to keep hope, and it's important to stay positive when you can. But when you're having a really bad day, if it's too hard to stay positive, then you don't, I mean, just honor your own feelings and be okay with that.